says, can you get pregnant whilst you're pregnant? Like, should you be wearing condom then? Like,
can you get pregnant whilst you're
already pregnant?
Yeah, like a second pregnancy.
Mm-hmm.
Yeah.
I don't know about TikTok people say yes.
How long can medication be used for after expiration? So after expiry date? Just eat healthy, guys. Welcome to the season finale of Consultation Room Podcast. Now, if you have joined us in the last 6 months, we have talked about a wide range of topics. So we've discussed mental health conditions. We've also talked about some chronic conditions, as well as some burning question episodes where we've talked about some of these taboo conversations that we don't like having. So thank you so much for anyone who's tuned in and listening to the Consultation Room Podcast in season 1. And we're so grateful. Keep tuning in because there is season 2 coming up. Now, we have a very special episode today lined up for you. This is to wrap up the season, and it will be probably what you need just to wrap up season 1.
Yeah, fantastic. So, as Julie mentioned, we have a special guest today. If you are on our socials, we did put up some clues on there that we have someone special here with us. And for this season 1 finale, we thought we'll get her here just to answer some few questions that you have put out there, and also for us to give us our input on your questions that you've put out there. So as you can see, we have a special guest here who is called Nana. So you may know her as Nana the pharmacist, and Nana is a friend, a colleague. We've known her for so many years, and we're so delighted to have her on our show, honestly. Nana has been a pharmacist for so many years. She has so much experience, like over 10 years of experience. I don't, she's laughing, but honestly, she does.
She's your go-to girl.
She's laughing, but guys, she has so much experience. She's been a pharmacist before us.
Yeah.
So we're like baby pharmacists here.
No, honestly, they're not.
Honestly, we need to give her accolades because she has worked across different sectors of pharmacy.
She has.
And currently she's in GP pharmacy. And honestly, Nana has built so much for herself as a pharmacist and as a woman.
Yeah.
I must give it to her.
Yes.
And if you do know her handle, she's called Nana the Pharmacist.
Mm-hmm.
She's built a platform where she shares her knowledge and her expertise of pharmacy, of different health factors. And she's been sharing it with her audience. She's built a great platform. You can find her across all social media, YouTube, Instagram, TikTok. So please, if you haven't, check her out. She's incredible, honestly. It's so lovely to have you here.
Welcome to the...
Thank you so much for joining us, gracing us with your presence.
Yes.
On the season finale. We're so grateful to have you here.
Honestly, I want to say thank you for, inviting me onto your pod. Yeah. You guys are doing amazing things. As I was saying earlier to you, I said no one else is doing this. Yeah. And you guys have stepped out of the comfort zone and come to join us on social media. So I love listening to your podcast. If you're not listening, please do, because you will learn so much from them. Honestly, they are amazing pharmacists. They've had different backgrounds as well. And talk about experience, they have got experience as well. But I'm happy to be here today, and thanks for having me.
Welcome to the consultation room.
That's right. So, just to start off, we just wanted a question we got from our audience. Mm-hmm. Thank you so much for everyone that did that. But one of the first questions we got was, why pharmacists? Why are pharmacists important?
Mm-hmm.
I feel like, we are important. Mm-hmm. We're part of the MDT, so multidisciplinary team.
Yeah.
Before, traditional pharmacists were classified as a first point of contact.
Yeah.
If you need any health advice or any minor ailments. but now we've branched out to so many sectors. But yeah, we fit in very well between a doctor's role and a nurse's role. So
That's true.
Say we're the medicine experts.
We are the medicine expert.
We know more than some doctors. I'm not even sitting here just saying because I'm a pharmacist, but I have experience and I've encountered certain, conversation where you have to chip in. But yeah, pharmacists are key within the community. We play a variety of roles. We hold a lot of hats.
We do.
People might not know that, but we do more than just sticking labels on a box.
Oh, yes. Yes. Oh gosh, they say that all the time, and it's like we're glorified shopkeepers. We are not glorified shopkeepers. We're more than that.
Whether you're working in the community, GP, hospital, industry, we're using our clinical knowledge for everything. So,
100%.
Pharmacists are very important within the healthcare. I say we play a vital role, and without pharmacists, a lot of things wouldn't.
I don't think that without pharmacists, the healthcare system could run like it does. No. Because you need that middleman who is the expert in medication. That, to be fair, I always say we are the medication expert. So the doctors cannot do without us, neither can the nurses, neither can the patients.
And you know what I say as well, the medicine you take is going into your body. Mm-hmm. Who better to tell you about it and to make sure it's safe than us?
That's it. That's it. Yeah, we have knowledge in regards to medication, pharmacokinetics, pharmacodynamics. That's us. Like, we are your people. Like, your doctors might not know some of these things, how it works. Some of the doses. A lot of times we get calls from GPs when they're asking what is the correct dose, and we kind of go through that with them because we are experts in medication. So that's why I think you need pharmacists. No, 100%. And to be honest, I also think we basically play a very big role in preventing medication errors. We know that there is a lot of errors that happens with medication, maybe a missed dose, maybe a miscalculated dose. We are there to pick up these errors. So we are the cleanup people, but we are also the experts, Yeah, definitely. We also got another question where someone wanted to know, they want to become a pharmacist. Do we recommend it? And what is a typical day for a pharmacist? And there was also another question on some of the misconceptions of pharmacists and their work. So we kind of put these two together just to have a quick sort of talk about this.
Yeah. I want to become a pharmacist. I mean, that is brilliant to hear.
It is.
I don't think personally when I was applying, I said I wanted to become a pharmacist.
Yeah.
I literally just fell into it.
Mm-hmm.
And I'm grateful that I did.
Yeah.
And I'm glad this person wants to be a pharmacist. Honestly, if you're someone that you enjoy science, you enjoy helping patients, and that sort of thing, I definitely think yes. Pharmacists, I would definitely recommend.
Yeah.
You shouldn't, sometimes some people go into a profession because of the income they're gonna get and stuff. Yeah. I think that should be the last thing you think about. Yeah. As a pharmacist.
Yeah.
Because you do start off,
a little bit. Listen. It won't pay for your Tesco shopping. No.
Especially if you're coming out from as a hospital pharmacist.
Yes.
Exactly.
Yeah.
Because I literally started in hospital, as you mentioned. Yeah. Most of my background is hospital pharmacist.
Mm-hmm.
I literally started as a band 5, you know. And honestly, you
are brave.
Literally just scraping it there. But, if you want to become a pharmacist, don't look at the income. Look at the end goal. What are you trying to achieve? Yeah. Who are you going to help? That sort of thing. And definitely let that be your goal for becoming a pharmacist.
Mm-hmm. Can I be honest though?
Yes.
The reason I didn't go hospital is because of the money. I'm not gonna lie.
I'm not gonna lie either.
Yeah.
That's fact. I could not stand being paid.
Peanuts.
I spent 4 or 5 years in uni, and you're going to tell me I'm getting paid.
That's it. I was like, let Steph and the rest do that. Take one for the team, but I am going where the money is.
Do you know what? I had worked in community a bit, and I just
You
thought,
enjoyed
okay,
it?
I already have that experience. This was before I qualified, so I was like, okay, let me see what the hospital is also about.
Yeah.
Literally, I'm just
But do you know what? After you've studied for basically 5 years, some people more than 5 years, the last thing you want is to basically earn nothing. You know. So for me, it was more of okay, like. I mean, the primary decision to be a pharmacist was I need to help people. I want to help people. That is what I want in life. But I also want people to help me.
Yeah.
You know?
I like that. Definitely.
that is very honest.
Yes.
No, it's good to be honest. Like, it's true. You need someone else to help you as well, because who's going to be paying for the bills? You're waking up early morning to come and help someone. Yeah. And I get it. That is our profession, but you know, it needs to be. So
Brilliant. And the pros of being a pharmacist, what I would say is that in terms of being a pharmacist, you know you're guaranteed a job.
Yeah, definitely.
Like when you come out,
Job stability.
That is one thing that was literally the reason why I stuck with it, because I knew once I come out of uni, I'm gonna get a job. The pros, again, we said, you know, to help patients and stuff. When it comes to cons, I do have my list.
Okay.
I feel that as pharmacists, we are underappreciated.
True.
Yep.
Especially coming from a hospital background. I feel like we're always in the shadow. And yes, we do. Like in the hospital pharmacist, you go and speak to patients to do their drug history and stuff. But apart from, like, once you're done with that, you're literally looking at your drug chart, make sure there's no mistakes, make sure the drugs are safe. So you don't get to interact with patients after that. So I feel like the patients do not, I don't know if it's respect or they feel like we're literally in the shadows.
That's it.
But I feel like it's like that amidst everywhere. It's as she said, we are not recognised within the profession. So like, let's say a community pharmacist, you feel like sometimes you're on your own. You have to make a decision on your own, because you don't have any other clinicians to bank on. Which I'm trying to say.
That's true.
And even with GP as well, it's like, being a GP pharmacist, there's some roles that you're not even meant to be doing. But they put it on you, and you're like, you're just there. Like, you know, you just get stuck in your room, which is, I feel like that narrative needs to be changed. It really needs to be changed.
And I think something like COVID kind of like made this even clearer. You know, during COVID, they were like, we clap for the NHS staff, clap for the doctors. Pharmacists, it took 4 weeks in us being bullied, let's be honest, in pharmacies for us to even be acknowledged for what we were able to do exactly. And to be honest, I think COVID actually brought out the reality of pharmacy, because people would come in, they were happy to wait for their GPs, because the GPs were open, I don't know, 3 hours a day, 4 hours a day. They were happy to wait for that appointment whenever it came. But when they came to pharmacy, when I tell you a guy almost stalked me, then I knew that, only because I didn't give him his inhaler. It was, it's COVID, you know, I need it. He hasn't had his inhaler for like 4 years. So there was no reason why he, all of a sudden, because it was that panic. And he was like, you know, I'm going to make sure you pay for this. I know what time you finish, kind of thing. And it's like, it literally brought it out. And I was like, you know what? There's no respect for us now. Definitely.
That's true.
I think, that's like a major con of being a pharmacist. I will put it out there.
No, definitely.
The other thing I will say is that the pressure of the work is really high.
The workload, definitely.
It's high responsibility as well.
I'm not gonna sugarcoat it.
Yeah.
You get tired, mentally and physically. I know we're not lifting anything heavy, but
it's true.
Mental more than anything.
Mental than anything.
I mean, to be fair, I don't know about you girls, but the first week of being a pharmacist was the toughest week on my body physically, because I don't think I prepared myself mentally that I was going to be standing for 8 to 10 hours. So after 3 hours, I was like, what's this one? You know, exactly. Like,
So, I mean, we have touched on a few, and let's go into the misconceptions that people have about us.
So, as we mentioned this earlier, glorified shopkeepers.
Exactly.
That is just I think that's the biggest misconception.
Yes.
So we just pick the box from the back and then stick the label on, which is really wrong. Clinically, I should have said mentally, physically, you're drained. You know what I'm saying? Imagine you've got Dorset, like 10 medication to check. You have to look for interactions.
That's it.
You have to look for dose, errors, all this. Everything. On top of that, you've got people calling you to consult. You've got a methadone patient waiting if you're working in the community.
That's true.
So this is one of the misconceptions that I think it needs to be. We need to put it out there, and which needs to stop, because as you mentioned, COVID literally pushed us.
Yeah,
we did a lot 100%. For the community.
Yes,
and where was our clocking?
A few weeks late. A few weeks too late. Oh no, it's true. Like everyone was clapping for everyone but pharmacists,
Another misconception is they always think pharmacists. You became a pharmacist because you didn't get into medical school.
Do you know how many times?
Do you know
we've heard that?
You're one of them.
I beg you're the reason we suffer. Really? Did you actually want to go to medical school? I did not want to go to medical school.
But now looking back at it, I'm like,
no. It's
but
the fluid.
They think everybody got into pharmacy
because
we couldn't go to medical school.
Yeah.
But that's not the case for everyone.
No,
it's not.
Yeah, so it's something that needs to,
Yes.
need to clear that as well. Like, you will find some people like
Steph. Do you know what it is? I think it's part of it is the society looking at pharmacy as second best.
Yes.
So it's more of, you shouldn't really, in your correct mind, there's no way you would pick pharmacy, So because of what it's considered, so it's like medicine is up here, dentistry is up here, and then pharmacy is just, if you fail, And
then recently there's one that I heard as well about how GP pharmacists wants to be doctors. That's what.
No way.
Like, do you know how the workload that we're doing in the GP surgery?
Oh my gosh.
I love the GPs. I'm not even but we do a lot for them as well.
Yeah,
so we're
100%.
not there because we want to be GP.
No.
We have a job role.
Yeah.
Yeah. So I think the next question was, what's a typical day for a pharmacist?
It depends what sector you're in.
What is your typical day, Nana?
So my typical day, when I go in, I have clinics. So I have could be hypertension clinic, it could be asthma clinic, morning clinic. Then I have my break. Then I have document. So document is completing discharge summaries and whatever needs to, any tasks that's been sent by the doctors to complete that. And then I have another clinic in the afternoon, or any an open appointment. So could be medication queries, could be anything. So that's my typical day. I start at 9, some people start at 8. So this is for the GP sector. And then I finish at 5. Some people finish 4 o'clock, depending on what time you actually finish. Okay. So working in the GP sector is not bad. I know my schedule. Whereas when I used to work in community, you get all sorts thrown out. Huge. I'm going to say you can have methadone patients. You go in, you have to make sure CD's balanced. You've got dispensing to do. You've got EPS to download.
Yes.
So it depends on the sector that you are, to be honest.
So
exactly. And I can say the hospital is different as well.
The
industry is different as well. And then now you've got people that are in tech.
Yes,
well. And
that's true.
And you ask them what's the typical day, they'll be like, pharmaco, whatever they have to do, they have to do. So it all depends.
That is true.
Yeah, so that's just like a little snapshot of a typical day. And as Nana said, it all depends on the sector you're in.
That's it.
Yeah.
That's it.
Okay.
So the next question was about medication, actually. So someone asked, are generic drugs as good as branded medication? And we all know there's patients who try our patients. They try our patients because they will literally ask for a specific brand, regardless of whether it's available or not. They say, I'm sorry, I've always had this. I cannot have this other brand, or I cannot have the generic. Why are you trying to give me cheap drugs? Is it NHS I paid my pension? Why am I having to have cheap drugs? We all have heard this.
This is so it's so common. We hear that all the time. I mean, once you said that, a patient he just came across my mind. So I had a patient who literally like they love Zapain. They love Zapain, and I don't know if you did hear, like there was a shortage of like Zapain, right?
At some point,
and we were just changing patients to the generic cocodamol, because as we know, Zapain contains cocodamol.
That's it.
And this patient was not having it. And we just try to explain to the patient. So when it comes to generic and branded,
that's it.
So they contain the same active ingredient. That's basically it. They're going to work the same way. And the only difference is that when it comes to branded, what the manufacturers do is that maybe the non-active ingredients are different to a generic. So for instance, like the color of it, the flavor of it, they may differ from a generic, so it may appear differently, but that doesn't mean that it affects the efficacy of the way the medication works.
That's it.
It doesn't literally affect like the performance or the safety of it. So I think it's one thing that people need to literally get that. No, a generic and a branded are the same. Like literally, you're literally just paying more for branded. And whilst you could just get it cheaper and
that's it
for generics. Even if you don't pay for prescription, like save the NHS some money and go with like generics.
That's it. I mean, the therapeutic effect is the same for both drugs, so there's no reason why. I mean, sometimes also it's psychological. We all know that. So some patients asking for Lipitor, they've never had a atorvastatin. You know, it's all psychological. You know, no, not atorvastatin. No, I don't know. It's got to be Lipitor.
An Alma's brand.
Exactly, an Alma's brand. Yeah, like, is that Bristol? No, I don't do Bristol. Yes, that is.
Sorry, like if you're making fun, but honestly, guys, it contains the same active ingredients.
It does.
The same way. Okay. Unless maybe like, you know, one brand, like you are allergic to
the flavour of it, the filler. Yes, 100%.
That makes sense. But in terms of like the efficacy, honestly, it's the same.
Makes sense.
That's it. That's it. And I think also the only difference in terms of like cost is just worth mentioning that is because with branded medication, the manufacturers do a lot of marketing for branded medication, hence why it's priced a little bit more than generic medication. So it's literally not expensive because it's supposed to be better or it's supposed to work better. It's actually just expensive because of what the manufacturers have had to put into in regards to marketing and all of that. That is literally the only difference.
Can I say something as well?
Of course.
Actually, when you said the manufacturers, I always tell patients, look at the ingredient.
That's it.
The active ingredient. Because
that's it.
Recently, I was locuming in the community and the patient came in to buy, I think it was Sudafed. But the Sudafed had two different medication on the shelf. There was two different on the shelf, but it was the same ingredient. But one was advertised, I think it was for, I can't remember, I think sinuses. And the other one was decongestion, but it's the same active ingredient. The same dose in there.
Yeah.
But the price difference was...
Yeah.
I said to the patient, I'm not even trying to, it's your money.
Yeah.
You can, you know, buy whatever you want to buy, but
that's
just look at what I'm looking at.
Yeah.
He was shocked. So it is literally marketing.
It is. It is.
Marketing. Yeah.
And that's why it explains why, let's just be honest, like on telly, there's a lot of adverts for like things like Viagra Connect. You don't hear no one talk about sildenafil.
No.
Do you know what I mean? No one mentions the branded, but then no one mentions the generic, but then the branded is always out there, you know, Sudafed. No one actually mentions Sudafedrin or generic.
I want
Viagra. That's it. Exactly. You know, so, yeah, definitely.
Brilliant. The next question, which we have, and I absolutely love this question, especially because we do get a lot. So this question is, can you continue using leftover medication if you have the same symptoms as your last time you use it?
Oh, that's very interesting. Okay. It depends what the condition was, what it was used to treat.
That's it.
So let's say if you had a bacterial infection, you're meant to finish your course of treatment, isn't it? So if you have leftover antibiotics are called. Why do you have leftover?
That's it. That is it. Yeah. That's it.
Exactly.
Yeah.
I think, again, as I say, it all depends on the condition. So let's say if it was you had a headache and a paracetamol, you can do that. If you had a rash, I would say it's worth getting the doctor's input first before using the cream.
Exactly.
You might think it's the same rash, but it might be something different.
That's it.
As pharmacists, I don't know about you guys, but I find it really difficult to differentiate skin rashes.
Yeah, no,
Really
definitely.
The only thing I can differentiate is like eczema.
Yeah.
But and then a few things because I've got children, so now I know.
Yeah.
But before,
Yes.
I was a bit clueless. So
Yeah.
if you have, like, let's say you prescribe a steroid cream and you feel like, oh, a rash come back, let me use a cream.
Mm-hmm.
It's not. I would say definitely do not use it.
That's true.
Definitely get it checked out.
That's
But a
it.
simple thing like paracetamol for headaches
Yes.
or migraine, ibuprofen,
Yeah.
I would say definitely. But antibiotics, no.
No.
I would say definitely not.
I agree with
Yeah.
that. I agree.
Yeah.
I think what happens is that we tend to make a lot of like self-diagnosis. Like,
Dr. Google.
And self-medication. Oh gosh, Dr. Google is the worst doctor. Should be banned, Dr. Google.
tell you your diet.
You know, honestly, yeah. You say, oh, you know, they come to you and they say, I Googled it and they actually said that I only have I'm sorry, you don't have a few days to live or a few years to live because apparently you're having cancer. And no. They actually, a lot of people have come and said, am I having cancer? This is what, I've got this. No.
Yeah. So what we're saying is that a lot of us like tend to make a lot of like self-diagnosis.
100%.
Which there's nothing wrong with when it comes to like some minor ailments. I think there's nothing wrong with that. But when there's something like unusual and stuff, I think it's quite important to get a clinician to actually diagnose you before
definitely.
actually saying, okay, I've got this, so let me try this medication that I used the last
Before,
time. No.
Yeah.
That I don't agree with.
100%.
Simple things, yes.
Yeah.
A headache. Use your leftover paracetamol.
Yeah.
Exactly.
You know?
Yeah.
But if it's something that you...
Definitely not. Don't do that.
No.
Yeah. But, you know, it could be the same symptoms as well.
Yeah.
But...
Could be something different.
Yes, but let's say, for instance, it's very reoccurring. You still need your clinician input.
Yeah.
Because maybe the medication you used the last time...
It's not the correct medication. That's
You
it.
need something else.
Yeah.
Definitely
Yeah.
agree with that. Yeah.
And I think even dosage, like dosage wise, you know, just because maybe you use a certain medication previously and it cleared whatever it is that you had at the time, doesn't mean that this time around you probably will be on the same dosage anyway. You might be on a lower dosage. Maybe it's not as severe or maybe a higher dosage. So it's more of, you know, you definitely need a clinician to give you that, okay, this is what it is. This is the medication. And of course, if they give you, I would say this, if they've given you the same prescription for the same medication, you've gone to pharmacy, you've got medication, and you do have some medication at home that is literally the exact same thing the doctor has given you, it is in date. And it's very important we look at dates because we have, I'm sure, you know, just amongst us we can come up with all kinds of stories when it comes to expired medication. Just, you know, you can't use whatever you had before as long as it's within date. You kept it in a safe place. You didn't just put it on the window. It's been, you know, it's direct sunlight. You know, you didn't store it. And if you put it in your cabinet, it's still within date. Then you can, because you currently have a prescription. So it's a continual prescription. Otherwise, no, definitely not. Definitely not. So there was also another question, still about medication, and this is very related to possibly what we just talked about. And it is, how long can medication be used for after expiration? So after expiry date.
Oh, Lord. I mean, it's expired.
It's probably expired.
Yeah.
Yeah.
Like, these manufacturers have literally done their test and said, okay, this is how long it can be used for. So if it's gone past that, please. And especially like our elderly patients.
Yeah.
Where like you go into their medicine cabinet.
Forget elderly.
Not even only elderly.
Some young people.
Yeah, some youngsters you have. Like recently, I did an asthma review, and I've seen her record. She hasn't ordered inhalers in a while, and I said, "Oh, show me how to use your inhalers." She used it, and I was like, "Oh, is it in date?"
It wasn't.
No.
It's like a year, and I was like, and she's still using it. Do you know what I'm trying to say?
Yeah. So I think of all, like, cliche across the ages, people just maybe people don't take medication to be to be as important a thing to even look at things like, expiry and things like that. So you think, oh my God, I've got a headache. Let me just pop to paracetamol. You don't even check the expiry. So literally across the ages, I think. But I think what they say is it's generally not recommended. Also, although sometimes. Yeah, it depends with what medication it is. Yes, they say.
It's like vapor rub,
Yes. Definitely. I'm not going to lie about it.
Yes. Yes.
Oh, I need that vapor rub.
Yes. You can use. And then you're like, oh, it's gone. Yeah, literally, yeah. But I mean, generally they say it's not recommended. But some medications can typically keep that potency of of how well it works and all of that, but not too far off the expiry date. So if it's, I'm sorry, we're in 2024, it says 2022, that is a cause for concern. But if it's like we're in,
a day or
a month after, but again, we're not saying a month after it's safe to use your medication. No, but we're saying technically it could still be okay, but generally we don't recommend it. So it's I always say, I always say, ring the manufacturers. Ring the manufacturers, because the manufacturers will always have, you give them the expiry, the batch number, they'll actually be able to go back into, of course, their books and check when this was manufactured. Is it still okay for a few days, or a few months, or, but to be fair though, the things I've done though with medication, that's between me and my God. That's between me and my God.
I mean, I do the vapor rub. Like, that's the only thing.
Same here. Vapor, definitely. Get rid of the rub.
A little bit of that, when they say like creams and things, 12 months, isn't it? I always think, I'm sorry, like, it's been 16 months, it's been 14 months. But it's not recommended. Please ring your manufacturers if you have any questions, if you're concerned. We're not saying go ahead and use that vapor rub. We're just saying that if you have to, do it, but please speak to someone just to get that sort of like thumbs up. Yeah.
And the next question, which we've got, is what are the common ailments to first speak to your pharmacist about before seeing a GP? I love this question. Because it's like making us seem really important.
Yes.
In these days, like getting a GP's appointment is really tough. Let's put it out there.
Yes.
Really tough, isn't it?
You'll be lucky. You'll be lucky.
I think this is something that we can discuss.
Yeah. Should I start?
You could.
Okay, so now that, I don't know if you're aware that the pharmacy first,
yes.
So that's a good thing on our side. I mean, the workload is, but it's good for the patient.
Yeah.
Okay, so if it's someone that's suffering from sinusitis, and you have impetigo, sore throat,
UTI.
But the ages, isn't it?
The ages differ. Depending on like the age group that you're in, you may not be able to give you a prescription.
Yes,
exactly. So these are some of the conditions, and aside from that, there's other conditions. So when you have a cold,
cold flu.
Flu vaccine.
People, do you know what? People don't actually realise that we do that. A lot of people don't realise we do that. Yes.
Travel clinics. Pharmaceutical travel clinics.
Yeah.
And when you have the hay fever season.
Allergies.
Yes. Definitely.
Don't go to your doctors, in fact. No. I'm going to say this today. Don't go to your doctors. Don't waste your money, because you'll get that £9.60, is it?
It's £9 something now.
60 now, yeah. So that £9, you're going to pay for a prescription. You will get the exact same thing. So don't go. Allergies, come to us.
Yes.
And minor skin
conditions
as well, isn't it? Like eczema.
Yeah.
Be treated as well.
Yeah.
Cuts, spray.
Yeah.
What else is there? Head lice.
Yeah. Oh, yes.
Yes.
Yes. unless I think some of these things, unless it's say like something like head lice, if it's a child, a baby, things like that, you might not be able to get that treatment over the counter in a pharmacy. So depending with like the age, and also I suppose how severe it is, if you've already maybe used, Steph is a very big advocate for home remedies. So she does this whole thing about chewing onions. So you've done,
That's it. Honestly.
So if you've tried your home remedies and it's not worked and you're not sure, you're like, oh, it's getting worse, maybe go to the doctors. If it's quite severe, of course, but come to us. We will definitely help. Yeah. Anything else that maybe is quite crucial that we haven't mentioned in terms of like pharmacy first, or like what people should?
We've mentioned it all. It's usually like any minor ailments, like we'll be able to help you with it.
Yeah.
There are some even counter medications. Yeah. So anything that you think is minor, literally do come to the pharmacy for.
That's it.
And we've also mentioned about the pharmacy first.
Yeah.
Which is what
the service
we can issue prescription for, like antibiotics and antivirals for these certain conditions and ages. So.
Yeah. And do you know what? It's also worth mentioning that your pharmacy is the first point of action, right? Yeah. So even if you're not sure, if you come into the pharmacy and speak to the pharmacist, if there's anything they can't maybe help with, they will signpost you to the doctors. So if you're not sure, if we haven't mentioned it, it doesn't mean that we can't help you. We can't provide some remedies or some information as to how to go about it. Yeah. Just come in, ring the pharmacy. Sometimes, however, when it comes to ringing the pharmacy, I'm always very careful about saying ring the pharmacies because we're so busy. Yeah. Let's be honest. And sometimes, if say the pharmacist is seeing a patient in a consultation room, like here, and no pun intended, and maybe the girls, the dispensers, I say girls, but there's also men. The dispensers are also very busy. Maybe there's someone who is popping a doset, they're concentrating on something like that. They might not necessarily be able to answer the phone. It's not because they're ignoring it. It's just because it is so busy. Like a day in a pharmacy can be so busy. So if you've maybe rung the pharmacy and you're not getting an answer, and you don't live too far from the pharmacy, just walk to the pharmacy, speak to the pharmacist. That might be a better way and an easier way to get that response to what's going on. Yeah. So the next question, which is actually still to do with sort of like minor ailments and the likes, was what medication should I keep in the medication cabinet at home? Yeah.
So this is like what? Like a first aid kit? Yeah. Okay, I love that. So personally, what I usually have in my home is pain reliefs. So
I suppose with children, you always have to have Calpol, ibuprofen.
Definitely you have to.
Yeah.
Honestly,
yeah.
So pain reliefs, your paracetamol or ibuprofen, literally like your go-to. Because if you're in any pain, paracetamol is literally like the first step. Even if you go to like your doctor, like paracetamol will always be like the first medication they give you before they step you up. So you always have paracetamol.
Yeah.
And then the next thing is ibuprofen.
Yeah.
The other thing I would have is plasters because especially when you have kids at home.
That's it.
Exactly.
There's going to be some cuts here and there, little bumps here and there.
That's it.
So you need a bit of plasters. I know they're not on medication, but I need to add that in there.
Yeah.
The next thing I would say is probably like rehydration salts.
Yeah.
Like when you have like diarrhea, because let's put it out there. We do get like diarrhea and vomiting here and there by eating.
That's it.
That is like literally something that we need. Or even if you don't have that, simple water with salt is fine.
Yeah.
Also, indigestion treatments I keep.
Yeah.
Because again, a lot of food like causes indigestion. So you just need this just like, for a go-to.
Yeah.
And my next one I will put is antihistamine.
Yeah.
Definitely. Because, with these allergies,
that's it.
fever,
yeah.
Or even sometimes like a bite also.
Yeah. Yes.
So I either keep like the tablets. I always have like, tablets at home.
Yeah.
Or some cream as well. It's just in case of a bite. Yeah. I mean, those are the main things I would have in my medicine cabinet. I don't know about you guys.
Yeah,
I don't tend to have a lot of meds in my cabinet. I always have antihistamines because I have a lot of allergies. So it's more, in mine are like prescription ones. So that already goes into my medicine box. Pain relief, it's almost guaranteed, right? If you're a pharmacist, you'll have some paracetamol at home, right? But I don't have a lot of that. Do you know why? I tell you why. Because in my house, and also my dad's, a lot of time medication goes out of date because you buy it because you're keeping it, and you're like, I'll just keep it just in case. And to be fair, the pharmacy is not always too far. Like the pharmacy is a walking distance. The reason I mentioned this is just to emphasize on the fact that if you can avoid having medication at home, maybe you should, because of safety purposes, especially if you have children. Like I have 2 nephews, and my 1-year-old nephew is at that stage where literally anything onto the hand, in the mouth, anything in the mouth. So you could leave something, and let's be honest, like some of these blisters are so easy to open. Something like, say, even Adcal, and they're massive. So a child will easily take that and put in the mouth. And, so for that reason, I don't advocate for having too much medication at home. But especially if you're very close to pharmacy, you can literally just walk there and get whatever medication you do. But there's the everyday ones. In the middle of the night, you have a bit of a headache. It's worth having some painkillers and things like that. If you've got heartburn, there's milk, you know.
But milk doesn't help.
No, it isn't. It isn't. But what I'm trying to say is sometimes you have like something like gastritis. So gastritis can literally cause the symptoms of like a heartburn and things like that. So you drinking something like that could actually help relieve some than having. I'd rather try something that will relieve something where knowing that the next day I can actually get something that will actually help, or something a bit, a bit more powerful, a bit more potent. But personally, I don't have a lot of medication at home. I don't know about you, Nana.
I do, because I've got kids.
Kids, yes. Yes. Yeah.
And you mentioned the point where, you've got nephews at home, and they can pick anything. It's always important to make sure that your medication cabinet is not reachable.
Yeah.
If you have kids at home, it's not reachable because they will find ways. Don't keep them from the cabinet.
No.
Always make sure it's somewhere that they can.
If you can lock it, even better.
Then that's better.
Yeah.
So with me, just like you, Steph, I've got painkillers, so paracetamol, ibuprofen, and I've got the first aid kit, so little bandages, everything there. I have got covers gone at home because I had to get heartburn every now and then. Milk doesn't work for me. It works for some people.
It does work for some people, but also depends what is causing it, isn't it? So
exactly. But I'm someone that like to try home remedies first. If it doesn't, then I move on to
I like that.
Yeah,
I am actually for home remedies. But do you know what?
Exactly.
Let me tell you what.
I would never buy cough medicine. When my kids have cough, I don't buy them cough medicine. Because evidence shows that cough medicine is not as effective as having honey and
lemon and ginger.
Evidence shows having ginger is more effective than cough medicine.
Yeah.
Cough medicine is full of cholesterol.
Definitely, sugar. That's sugar. Because it's a lubricant. You just need that. It's literally all they need is something to just lubricate the throat. Yeah.
So,
100%.
There are some times you just have to try the home remedies.
Yeah,
if it doesn't work.
That's it. But Steph,
home remedies. If you are on a regular medication, please don't try it.
Yes. But we're not trying no chewing no onions, Steph. She chews onions.
Let me tell them the thing. Yeah. So when you have like a little cold, congested, chewing on raw onions, it actually helps. And ginger.
I was going to say that my friend puts them underneath her skin.
I've heard that,
and it worked. I've tried it once. It worked. It worked.
I've heard that.
If the smell is not good, I'm not going to say that. You know what I mean?
Do you know what? I think for me is that I don't like onions. I don't like onions in my salad. I don't like, if they're not cooked, I don't like it.
Really?
Yes. And I think that's why for me, really, like in a salad, you'll have onions. There you go. Cooked. Yeah. Okay.
But when it comes to home remedies, it actually works.
I'm sure it does. I am sure it does.
Yeah. It's not pleasant at all. Yeah.
The thought of it already is just traumatizing me. Just imagining that I'm gonna, oh my God, no. Anything else, literally whenever someone has a cough at home, we don't get cough medication. There is literally, because a cough sometimes, especially if it's a dry cough, it just needs lubrication, So things like that, yes, 100%. But the onion? That is pushing it.
That's Okay.
That is pushing it.
To myself.
Yeah, why not?
So the next question we have, again, to do with medications. We are experts of medicine, so that's fine. Why do some medications cause me to pee more than usual?
Okay.
Yeah.
So, I mean, to start with, we have talked about side effects, like all through, we have always mentioned side effects. You come to the pharmacy, we'll always, tell you, beware of some side effects. So some medication have urination or excessive urination or incontinence as part of the side effects or one of the side effects. So that could be the reason, extreme urination or you're peeing, more than you normally would, could be because of the medication you're taking. But it could also be because maybe that medication is actually working as a diuretic, or maybe you're taking diuretics. So if that's the case, then it will actually cause you to pee a little bit more because it's going to remove fluid from the body. And the only way it's going to come out is through urination. So, I mean, some medication also causes you to sweat a bit more. So it's all about how the medication works, isn't it? Yeah, no, definitely. I mean, is there any medication, girls, you can think of that causes you to pee a bit more than usual?
As you mentioned, diuretics.
Yeah,
that's true.
Wake up in the middle of the
That's it. That's it. Okay, so next question is it safe to drink alcohol whilst I'm taking medication?
I love that.
They're like,
I'm sure this is from one of our Gen Z.
yes. Yes. They're like, oh, that night out. Oh, that night out. I'm not going to give him a night out. Yes.
Okay, no, it's a good thing you asked
Yeah.
this, honestly. What normally we do when you do come for your medications, a pharmacist would advise you as to how to take it.
That's it.
Most of the time, we will tell you not to take it with alcohol, or it will be written on the label, avoid alcohol.
That's it.
So the thing about alcohol is that it does cause a lot of sedation, and it does impair your judgment, cause you to have a bit of drowsiness and stuff. So, and alcohol can interact with a lot of medication.
Yeah.
So we normally say avoid alcohol. So imagine if you're taking a sedative medication and you do drink alcohol on top of it. That is literally
double whammy. That's literally double whammy.
Definitely.
Yeah. They did say, I mean, I don't know if I'd slept in this class or I hadn't had my things, but alcohol is both an inducer and an inhibitor.
Yeah.
So it could induce the effect of certain drugs, and it could also inhibit some of the medications. So it's more like it's, if you're going to have a side effect, the side effects will be even worse because it's inducing the side, the medication. So you're likely to get some of the side effects even worse, or it's inhibiting it. So it's not working as well as it should be working. So alcohol, do you know what? Sometimes when people say, it's just, I'm on a night out, or, they're on a night out and then they say, I'm taking medication, so I can't drink. A lot of times I'm tempted to ask, what medication are you taking? Because there is some medication where, a glass should be okay, should be safe. Yeah. But I'm always like, I don't want to educate them too much because let me tell you what, that's my excuse. Because if I don't want to drink, I say, oh no, I'm on antibiotics. So whereas some antibiotics, it's not safe. You can, just not excessive. There's some antibiotics you shouldn't. Metronidazole you shouldn't drink. But so I'm like, no, you're on medication. No, you shouldn't drink. No, but to be honest, if you can avoid it, why not? Because you don't know. Also, let's all be honest. People are so different. Everyone's body is so different. So the way, say, someone's body will take alcohol is very different from the way someone else's body will take it. So it might induce someone else's, or it might induce the medication that someone else is taking. Whereas for someone else, it might not. So if it hasn't for someone else, and you say, actually, when I had that, I was fine. You don't know that. It's not a guaranteed for everyone, isn't it? No, definitely.
Fantastic. And this is a similar question.
Yes.
The next question is, should I take my medication with food?
Okay. It depends the type of medication people prescribe.
That's it.
Some medication means you need to take it with food to protect the stomach lining.
That's it.
Prevent you from getting any should I say, heartburns or stomach indigestion.
That's it.
So there, just read on the label, I would say. If it's taken with food or after food, make sure you take it with food. So, for example, like if you're taking an NSAID, so ibuprofen or naproxen, then you want to protect the stomach lining.
That's
so
it.
Definitely take it with food. But something like paracetamol, you should be fine. Certain antibiotics, you don't really need to take it with food.
Yeah.
Because as she was saying, it can inhibit.
Yeah,
food can also cause. It can inhibit or induce. So definitely read the box.
That's it.
Read the label, or if you're not sure, read the information leaflet as well. Sometimes it does say on there.
Yeah, there's a lot of information on information leaflet. Yeah. Some people say, "Oh, I just open it and I chuck in the bin," you know. But if you're not sure, there's always some information on there. Although I don't know about you girls, but I always try not tell people to read the patient information leaflet.
Sometimes it's
some of the side effects.
Like some ridiculous side effects here, and this patient will be like, oh,
but it says
death, fatal. That's all they take away with them.
No, honestly, saying that, I had a patient this morning. She was prescribed sumatriptan, and then she says, "Oh, but I read the information. It says if you have high blood pressure, you shouldn't be taking it."
Oh my god!
And I was like, it depends on the circumstances.
Yeah. That's it.
Before a medication is issued to you, we do a vigorous screening to say yes you can, so you can take it. Yeah, it's true what you're saying.
And these manufacturers, they just list these like conditions out just for like, let's say to cover themselves.
But
before like a clinician will give you a medication and stuff, they make sure that the medication is safe.
It's safe,
So like the manufacturers have listed it in their product leaflet. That doesn't mean that you are going to get the side effect or you can't have this medication.
That's it.
You know, some side effects are literally at the bottom.
Like it's one in a million.
Yes. You know.
But do you know, I get a lot of patients, I don't know about you, but I get a lot of patients where they say, it says that, this can happen. And you look hot, like the statistics, and it's 1 in a million. But they're like, I'm so unlucky. I bet you I'm probably going to be 1 in a million. Yeah, like, but you can't argue with someone saying that, Yeah. But the patient information leaflet, 100%. There is a lot of information on there. If there's even things like contraindication. So when medication is not suitable for you, all that will be there. But I always say if there's any questions, so if you read the patient information leaflet and there's any questions, speak to us. Yeah, definitely. We always will have answers. But some medications that can or should be taken with food, just generally. Could you just mention a few that is very common?
Actually wanted to touch on that. So as Nana mentioned, there's some medications you need to take it with food. And we did also say there are some medications you shouldn't, because like when it comes to like these things, like some medications, they get basically they may be affected by the food, so like the absorption, the way the excrete is, so that's why we need to check. So when it comes to the medications that are not affected by food, like you may. Or the ones that are actually affected by food, you may be told that, take it maybe in the morning, first thing in the morning, such as like levothyroxine, such as like alendronic acid, because
food will affect the way they work.
So those are the reasons why.
And then certain medications, just for GI protection of the stomach, you have to take them with food. So your everyday ibuprofen NSAID, that is like the drug that you have to take with or just after food. It's never recommended to take some drugs like that on an empty stomach, because any drug that is going to cause that irritation in your stomach, ulceration, things like that, it's just recommended to take them with or after food. So the next question is, can I split or crash my medication?
That's a good question. Maybe it might be someone that is having problems swallowing or something. But one thing we will say is that we do not recommend that you split it or crash your tablet. Always speak to a healthcare professional first, because there are certain medications, the way they are formulated, once you split it or crash it, they're not going to work as effective as they are as a whole. So it's best not to split or crash a tablet without speaking to a healthcare professional.
That's
we actually check the medications that can be split or crushed. If you're having like problems swallowing or something, we can change it to an alternative for you.
Yeah.
It could be maybe a liquid. It could be a tablet that is more like we can't crush it. But don't make your own decision to split or crush your tablet without speaking to a healthcare professional.
Yeah.
And sometimes when you do split it or crush it may actually cause more side effects to you. So.
And also, sometimes you can't evenly split a tablet. So if it's not scored and you split it, you might get a quarter and a 3/4. So, you might not get an even dose. Yeah. So there's that as well. And also, I don't know if you've heard this, that sometimes some patients say, I don't know, someone is having a problem swallowing medication and they have maybe a capsule. And capsules are, you can open them.
Yeah, they're opening up.
Into the yes. So with some of that as well, if the capsule itself, the capsule, container, the capsule itself is supposed to be gastro resistant, and you're taking this medication outside of that, you're actually exactly. So before doing some of these things, have that chat with a pharmacist, maybe even speak to your doctors, and if you're having problems with taking medication like that, there's always, as you said, different formulations. There's the liquid, there's suppositories, which are not comfortable, but there's a very easy way to use a suppository. There is different formulations. Definitely. But there is some medications, I think probably you both can agree to this, where say there's a certain dose that is that's not available.
Yes.
So a lot of times we have had, especially lately, I don't know why, but lately we've had a lot of medication where there is, 80 milligrams of this medication is not available, or 40 milligrams, for instance, is not available, and they need 80 or vice versa. So if everything is okay, we will safely tell patients to take either half a tablet or a quarter of a tablet. And most of the time, if it's scored, we will, it will be easier for you to, or even we do cut tablets for patients. So some medication is safe. And honestly, the best and easiest way is speak to pharmacists.
Yeah, definitely.
Yeah.
I just feel like people should always speak to their healthcare professionals before actually doing something.
Yeah.
It makes sense.
Yeah. 100%.
Fantastic. The next question we have is, what if my medication make me sleepy? Because there are some medications that can cause a bit of drowsiness.
Yes.
Yeah. So, if it's making you sleepy, that's generally like the side effects of the medication. And depending on the time you take the medication.
Yes.
So if you prescribe, let's say, amitriptyline and you take it in the evening, that side effects is the drowsiness. You end up sleeping. And sometimes some patients report being sleepy in the morning as well. So I would say advice, it depends. Speak to your pharmacist. Some pharmacists would say take it probably like 3 hours before you go to sleep.
That's it.
Then when you wake up, you're not sleepy. Or it all depends on the medication. You can change the timing of when you take the medication. So let's say you've got a medication that's going to make you sleepy, it's like antihistamine, and you know that you're going to work, you work with machines, tools, then I would advise to get a non-drowsy version.
That's right.
There's one there. If it's a prescription or prescribed medication and you feel like it causes drowsiness and affects your work, it affects your mood, whatever, speak to your pharmacist or your doctor. They will be able to change it. There's always different types. You don't need to be, suffering. Because, I can't,
definitely.
Not adhering to your treatment and then, of course, making your condition worse. So I always say, speak up. If it's not working or even if it's causing drowsiness, definitely speak up. They'll be able to change it. And then again, before even changing the timing that you're taking your medication, speak to your pharmacist or your doctor. They will advise you when best to take it to avoid the side effects.
100%.
Because the side effects, sometimes there's something that you can't avoid. It will happen. And if it's going to make you sleep as well, it's important to avoid alcohol.
Yes.
That's definitely.
There we go.
Other medication that will make it worse.
Yes.
That's what you don't want. That's what I would say in a way.
That's it. Okay, so the next question is about age, and we get a lot of this in pharmacy. So the question is, can age increase the risk of side effects with medication? So if I'm older, does that mean that I am at risk of having certain side effects a bit more than it maybe when I was younger? Yeah.
I mean, with age, as age progresses, a lot of things changes in our body.
Yeah.
Age is a natural process,
Yeah.
which is inevitable.
Yeah.
When you're aging, like some of your organs begin to be a bit slower. Maybe your fat deficit's a bit low. You're a bit on the lean side.
That's it.
Yeah, and yes, age can affect like the way medications work.
Yeah.
Because again, it's going to affect like the absorptions of it, the way the medication is metabolized, the way it's distributed, the way it is excreted from the body, and because, as I said, your organs are probably working differently now. You're not able to metabolize the body as quickly as you usually are.
Yeah.
Like when you're older, it may be a bit slower, So, yes, once age comes into it, we do consider all of these things.
Yes.
And because it does affect like all these processes, that can increase like the risk of you like getting side effects. Because if the medication is not absorbed properly, it may cause some side effects. If it's not excreted from your body on time or properly, yes, it's going to be in your body for so long, which can also cause some side effects.
That's it.
So yes, with age, I would say
I think simply the answer to that is yes.
It is, yeah.
Even as a child, the dose. That's why doses are different depending with age. So even with children, especially with babies, they actually go with weight because. Like especially for babies, you don't realize how much literally the tiniest change in like maybe even the age of a child could affect the dose of a medication and how well it's excreted, how well it works and things like that. So simply put, yes. Simply put.
Agree. This is kind of similar questions that we've already had before. It says, are there certain foods or drinks that should be avoided while taking any medication?
There's always.
There is always.
There's always. Like as we mentioned, food and drink like interacts with like our medication. So again, always like speak to your healthcare professional or read the
patient information leaflet.
And then the label as well.
What are the common foods that you
there's some very common ones. Well, there is that,
Coffee interacts with you for her.
Isn't it? Yeah.
And if you're taking iron tablets, milk, dairy,
that's
coffee
it
as well.
Yeah.
It will interact, what else is
grapefruit juice. That is like a very common one. Yes. Grapefruit juice.
Thank you so much. And I would also put cranberry.
Yes, with
and also let's put it out the vitamin K rich.
So leafy veggies and things like that. Yes. Because vitamin K is what you need to, for red blood cells and all of that. So if you're taking too much of that, it's definitely going to affect your warfarin because warfarin is supposed to be helping with like blood thinning. So definitely. And also, I think high fat foods with things like anti-cholesterol medication, as well as even just high fat foods with a lot of medication, because because processed foods, isn't it? Processed foods with a lot of medication is not really recommended. So just eat healthy, guys. So the next question is, what are some common everyday vitamins that you should advise on?
Okay, I like this question.
I was going to say, this is Nana's. Nana's just take the floor. This is you. Yes. She is big on vitamins. So, yes, you're very big on vitamins, and I appreciate that.
It's something that we've been told to stay away from. I don't know. When we were in uni, they really didn't. I don't know about you guys, but we didn't.
It wasn't driven. It wasn't driven
at all.
No, it wasn't driven at all.
It was somewhere like, you can get all your vitamins and minerals from the food you eat. But what is the food you eat?
That's it. And also then and now, and to be honest, I think the foods we eat, even in the textbooks, has changed.
It has.
The leafy vegetables. It's not just leafy vegetables. There's non-bio leafy vegetables now. Do you know what I mean? That is true. Yeah. It's no longer the same.
It's not the same. So I would say
modified and all of that.
A lot of things have been modified.
Yeah.
And crops are not the same.
No.
5 years ago, even a year ago, you would still say it's not the same. It's so different. So
Yeah,
things
100%.
Chicken are enhanced.
Eggs.
Eggs are enhanced. Do you know what I'm trying to say? So we're not getting the amount of vitamins and minerals that
Naturally.
we need
Yeah. Yeah.
But I would say before you start any vitamins and minerals, make sure you speak to your healthcare
100%.
first.
100%.
Make sure you get your bloods done before. And there are some vitamins companies that actually do bloods and recommend based on your bloods and based on your answers.
Oh, very good.
They give you the recommendation of what
Like
you
a
need.
tailored.
Yeah. And
That's good.
they're
Yeah.
very, very, very good. Like literally vouch for them. But yeah, the everyday vitamins and minerals I recommend is vitamin D. If you're a woman, consider B complex.
Yeah.
Okay.
Yeah. Magnesium, if you're someone that's a migraine sufferer.
Yeah.
Like, or you have a PMS, definitely magnesium. Always do your research as well.
And muscle. If you have muscle, people work out.
Definitely.
Yeah,
definitely.
Magnesium.
It works. I'll say magnesium. But yeah, as I said, vitamin D is number one.
Yeah.
We're all deficient.
I mean, we live in the UK.
Yeah,
As well.
Let's just be honest.
Yeah.
There's no vitamin D.
Yeah, amount of letters that I get from
Yeah.
clinicians to say we need to issue vitamin Ds in your life, even to children as well. As I would say, children age 1 to 5, they need a vitamin A, C, and D. So that's definitely something that you need to go. I know some parents are, I don't like giving vitamins to children, but to be honest, vitamin D, A is essential,
Yeah.
C is essential,
Yeah.
C and D work together.
That's it.
For bone.
Yeah. Yeah.
So you might think that your child is getting enough through diet, but they're really not.
No.
How much do children eat? They're really fussy when it comes to that.
Oh gosh, yeah, that's true.
So
Yeah.
I definitely say. And recently I was reading an article on women that are on contraceptives. Contraceptives actually, some studies have found that it depletes certain vitamins and
That's
minerals.
true. Yeah.
So it's worth reading about it and say, if you need it, then speak to your healthcare professional. They'll be able to recommend something for you. But most clinicians also will say that you don't need it, you can get it from your diet. But if it's someone that do not have a healthy, balanced diet, there's no way you're going to get them. Definitely not going to get them. So know yourself, advocate for yourself, know your symptoms. If it's not helping, ask for a second opinion.
That's it.
I will say that, definitely.
Yeah.
I agree. Like what you said, especially when it comes to kids, they're not getting a lot of like nutrients from what they're eating.
No.
Like my kids, I give them multivitamins every single day.
Exactly.
Every single day. And even myself, I take a multivitamin because I know I'm not a big eater when it comes to like
vegetables
and vegetables.
Yes.
Especially the vegetables. Like you have fruits, but vegetables.
Yeah.
So I know I'm not getting all my vitamins.
Exactly.
So I definitely like take a multivitamin which has like all these general like nutrients in there.
Yeah.
And if there's anything that I'm lacking, as you said, you go for your blood test.
Yeah.
If you know what you're lacking, then you add it on top of like what you're
Exactly.
Sure. Yeah.
And pregnant women as well. You know, your prenatal, your postnatal is so important.
Yeah.
And it's funny because sometimes when I read studies, like certain studies are linked to certain conditions, and you'd be like, wow, okay, maybe this is what the problem is. You know? But as I know, sorry to say this, but Africans don't like taking medicines.
Yes.
And
that's true. Honestly, this is not even.
My knee,
my
waist,
my back, yes,
because you're lacking certain nutrients.
100%.
You might think you're eating right, but you're not eating right because how much nutrients are you getting from the?
But try to tell that to a proper African man, like you're not eating well. They're like, but I eat everything that. I eat chicken.
Rice, what nutrients are you getting from the rice?
Yeah.
You know, and certain vegetables we cook them, but do you know that overcooking certain vegetables, you're losing out.
You are 100%.
Exactly.
Vegetables.
Yes.
You know, like if you can blend your green vegetables.
Yeah, and eat them raw. Eat them raw. Yeah,
that's it.
Yeah,
you know, so.
No, 100%.
Our diet has changed. It's not the same as 10 years, 20 years
ago. No,
it's not the same. So
and the foods as well. Foods have changed. You know, we're literally laughing about this. So let's be honest. Like foods have changed in terms of even how they are being produced.
Yeah.
So because of the bulk production of food, it's not really produced the way it should. So there's not enough nutrients you get from foods. Yeah. Let's just be honest. But there is some nutrients you will get from food. So as much as we're not saying just eat whatever you want in the junk and just depend on your vitamins or just rely on your vitamins. You know, just try eat better. Your green veg. Just make sure the balanced diet. We all know what a balanced diet should be, but also on top of that, as you said, some of the vitamins, vitamin D is so important. In the UK, we barely get any sun. If you actually, I bet you at least 80% of people in the UK will find out that they're either deficient of vitamin D or on the lower end. Yeah, so vitamin D more than anything, 100% advocate for it. And also, we all know that some conditions will cause you to have low vitamins, certain vitamins.
Yeah.
So things like, say, people who have, say, fibroids, you bleed a bit more during certain, during the month, certain time of the month. So you will need the iron. Definitely. Just I think what you said is very, very literally right on point, which is get your bloods done. Yeah. Get to know your levels and then get to take medication according to your levels, or vitamins in this case according to your levels. 100%. 100%.
And this question is, I struggle with falling asleep at night. What should I do?
Okay.
So first of all, I would say, what is your routine like before going to sleep? Mm-hmm. You have to look at your lifestyle. Yeah. If you need to make any lifestyle changes. Mm-hmm. So some people will drink, like, let's say, coffee 2 hours before they sleep, or 1 hour sleep, and you will struggle to sleep. Some people will be on their phones. Yep. There's so many things. So first of all, you have to look at your habit, your lifestyle. If there is something that's preventing you from falling asleep, then you need to cut these things down. Mm-hmm. If you're someone that certain medication will also help stop you from sleeping,
that's it.
So you need to look into that. If you're taking any medication, that's going to cause that. Mm-hmm. But I would say, before taking anything, look at lifestyle. Yeah. Your lifestyle is key.
Lifestyle.
Try and make changes. Yeah. Know the root cause of the problem. Don't go to the counter to reach for herbal or Nitol. That's
Nitol is always Nitol. Sleep is Nitol.
No. Definitely. Because one thing people need to realize is these medications are not getting rid of the problem.
That's it.
They're just masking it.
Yeah.
Do you know what I'm saying? So it's temporarily, that's it. And after you still end up with the same problem. Yeah. So if you can eradicate the root cause,
100%,
then definitely that will be better than reach out the medication.
Yes.
If you try that, and it's, as you said, you need temporal relief, then fair enough. Why not? But it's not, don't depend on it. Mm-hmm. Don't depend on it. Look at your lifestyle. So what am I doing before, an hour before bed, 2 hours, or even 3 or 4 hours before bed?
Yes.
What are the things that I do? Yeah. What can I do? There are some, there's a YouTube thing called Sleep, I've forgotten the name, but if you just type in sleep on YouTube.
I think Sleep Aid,
it will tell you, it will help you.
Even some apps, isn't it? Some apps, Sleep, I think it's called Sleep, isn't it?
Definitely.
Yeah.
So I would say, that's my
before medication, always literally lifestyle. Yeah. Like that is, and also some people eat so late in the night. People don't realize this.
You've been eating ever.
Exactly. At 9 in the night. Why won't you? Like some of these foods, some foods are meant to put you to sleep. Yeah. But some of these foods, because of how heavy they are, your body is now working. You need your body to be relaxed. So, I think also meal times is so important. It's so important. I don't know about you, but Africans don't like eating early. No. They're like, I'll be hungry before bed.
Yeah. No, that's what they say. Yeah.
No, but we're talking generally. Generally, Africans don't, so it's like, dinner's 8, 9 that's when dinner time. That is so late. You're not even giving your body enough time to do what it needs to do. And then to get into that sort of zen. Yeah. So I think meal times more than anything is honestly such a big deal. And they say as well, I think going for a walk before bed. So just after a meal, you have your early dinner, say 6, 5:30, whatever time is early enough for everyone. And then go for a little walk, because your body almost does the digestion. You get a little bit tired as well. So your body kind of wants to just relax. So little things like that. I don't know if you girls have tried chamomile tea as well.
I've heard of it, but I've never tried it.
I do try it, and I don't know what there is in chamomile tea. We definitely need to do an episode on that, because there's something about chamomile tea that literally just really puts you at ease, and just you just fall asleep easy.
Like
so
lavender, isn't it?
Lavender oil before bed shower.
my thing I was just about to say,
shower.
Literally a shower before bed.
Yeah.
It makes me sleep so good.
Yeah.
Clean sheet.
Yeah. I'm sorry, that's true. That is true.
Magnesium flakes.
Magnesium.
Put them in a bath.
No, because that's relaxing muscle. It
relax-
relaxes muscle relaxing, yeah. Yeah. There's a lot of things that people can do before going for medication. But you know what? There's a lot of time patients come in and they say, oh, I've had bad news. I've had death in the family. I'm really struggling. And, to be fair, I'll probably be very, very quick to be like, okay, we might want to try something temporarily, because the last thing you want to tell someone like that is, have you tried going for a walk? It's like they're already going for, do you know what I mean? So depending with what is going on, exactly. If it's a lifestyle that you can change, 100%, that is probably what you need to do. But if it's a temporary thing that is happened and all of a sudden this is actually such a big problem, speak to us. We will always advise on what is best, isn't it? So I think that actually concludes the topics that we could speak on today. Now we have we had quite a lot of questions, but a few of the questions we will possibly be talking about in season 2, because they deserve more than just 5 minutes of conversation. You know, some of these are actually a whole topic, you know. Yeah, but what we'll do is we'll just very quickly go through them and then just maybe one-liner. So maybe one of us just dips in and then we go to the next one. So the first question was, is it safe to take minoxidil or finasteride for a long time for hair loss or even after hair transplant? So I think the answer to that is you can. Yes, it's safe.
With any medication, so far as like you take the right dosage and you're not going over the board, I think it's safe to say it's fine.
Yeah, just always speak to a healthcare professional.
And monitor yourself for any side effects, and do the monitoring that you need to do.
Yeah.
If there's high blood pressure, that's
it. Yeah.
That's true.
Yeah. And the next one, which was really similar to this, was does hair grow at different rates?
Yes.
Which we will touch on, like in our hair loss. Yeah.
Yes.
Simply put, yes, it does grow at a different rate. And at different places, it grows at different rates.
I mean, if your hair some other places grew the same way as the hair on your head, we would have problems. But that would be a different, you can't be shaving someone that the same way. But yeah, I mean, you're right. Simply put, yes, hair does grow at different rates. Another question we got, and I think we've kind of touched on it slightly, is what causes fibroids. And there isn't one thing. That's the thing. It's a conversation. Just personally, just putting it simply is hormonal like changes and hormonal levels being a little bit out of sort of like level that can cause fibroids. But I think this actually needs a proper sit down. And Nana, please, if you don't mind, we will need you for some of these topics, because we need like everyone's input on some of these topics, because this is something like fibroids. Let's just be honest. It's something that is affecting a lot of us. Yeah. So almost a
lot of women,
especially you will know someone. You either suffer from it or someone. Yeah. So this is definitely a topic that we will discuss in season 2. So yeah, you don't want to miss season 2.
You know what? I love this next question. It's so candid.
Yes.
And I think we need to, it's like a burning question.
It is a burning question.
The next one is, why my knickers are bleaching without using domestos?
Oh.
Mm-hmm.
Like, you get it?
Yes.
And this actually happens a lot.
Yes.
Honestly,
yes.
I love this question.
Yeah.
It's so personal. And we do go through that a lot as women.
Yeah.
And simply put, yes, like it does happen because of like the pH of the discharge.
Yeah.
Exactly.
But we will get into it.
Into detail.
Yeah. Of it. So
I think it's worth talking about like just women's health, everything from head to toe. Why does it happen like this and not like this? Why am I sweating under my boobs? Things like that. That is all women, and it only happens to women. So gosh, this is like a whole, you're right. Season 2 is looking good, I think. Yes.
Okay.
And the next question is, can fruit, I suppose all food, affect the smell of your vagina? Now, this is yes, but this is again another whole topic, because it's not just the vagina. Fruit and food can actually affect even our
Body
odor.
odor.
Yeah. Sometimes the way you smell is actually because of what you're eating. So this definitely needs, I think, a whole topic. Maybe we can talk about this as well as, of course, the knickers bleaching without using domestics. This is, I think, together, but definitely a season 2 topic. Yeah.
Brilliant. This is a very general question as well, which I love.
Yeah.
It says, what skincare products are must-haves that everybody should use?
Okay.
Yeah.
I think it depends on the person.
Yeah.
Isn't it?
But I'm sorry, sunscreen.
Yeah.
I'm gonna just put it out there.
Sunscreen.
Like, if there's one thing you use and literally you don't have to use anything else, make sure you use sunscreen, because let's be honest, like, things have changed. You know, there's a lot of like skin cancer, and I think that's why I think this is a season 2 topic, because talking about skin cancer and maybe some of the causes of it, and especially with Black people, because Black people, it's diagnosed later when it's like a later stage, because again, some of it is this whole myth with sunscreen. I'm Black, I don't need it. So, yes, melanin. Like, my melanin is popping, is protecting me. So I would just put, if there's one product until season 2, you have to run to Boots or Superdrug or online and get is sunscreen. Make sure you get sunscreen. That is like one product personally I would put, because regardless of what your skin is, what skin type is, you definitely need some sunscreen. Yeah. So another question is, I've heard that VO2 max reduces the risk of cardiovascular disease. Is that true? And how can you increase that?
So I'm not familiar with this. Because apparently this is to do with an Apple Watch.
So on the Apple Watch, if you do have an Apple Watch, whenever you're doing an activity or whenever you're working out, to be honest, even when you're not, it tells you if your VO2 is high and if your VO2 is low. Now, if your VO2 levels is low, then actually you get a message saying you're at risk of a cardiovascular disease. So you need to increase that. Yeah, so that is a season 2 episode. I think we have to talk about that. Naturally, the answer to that is yes. VO2 max can actually increase your risk of cardiovascular disease. Now, the reason for that is season 2. Because it is so, like, it's such a detailed topic. But if you do have an Apple Watch, just have a look and you will see what your levels are like if you're on this sort of like safe zone or you need to do something about that. But just simply put, it's VO2 is, again, O2 oxygen. So when there's less oxygen, you know, that's a risk normally. You know, if your body has low oxygen, generally, that is a risk. Pumping as your lungs, you know, so definitely a season 2 episode. But yes, that is true. And how to increase that is season 2.
So another question is, I take creatinine to increase my strength.
Yeah.
Okay.
Are there any negatives in taking it for many years?
Okay.
I mean, I just came across this post from one of the doctors that I follow.
Oh, good.
If you're taking creatinine, it's worth doing a blood test to check, because it might have an effect on your EGFR. So your
kidneys.
So yeah, definitely, I would say it will have an effect if you're taking it for a long time.
For a long time.
Yeah, it's worth having a blood test done. Yeah.
And I suppose if you have a problem with the kidneys already and you're taking some of this medication or some of these add-ons, supplements, whatever, it could actually, you're overworking the kidney, which is already, you know, it's already bad enough. So yes, definitely. I think with everything, always double check with your healthcare professional. Always go for that yearly check. We always talk about yearly checks, and people are like, I don't need it, I'm fine, I've not had any side. No, go for that, just to give you that thumbs up that everything is good.
And I would say if you're over the age of 40, it's free on the NHS.
Well, there you go.
So you can go to your GP and just say you want to do an MOT. Yeah,
basically.
You on your car, so
why not? And your car is like, you can buy another car, but you can't buy another body. That's it. 100%. So another question, but we have kind of touched on it actually in season 1, but I think it's actually worth us talking about it in season 2 as a whole topic. And it is, what are the side effects of metformin? Now, I think this is maybe a listener who has been taking metformin. They're like, what are the side effects? Maybe I've been feeling a certain way. Is this being caused by metformin? There is quite a range. There's quite a range of side effects. We have talked about flatulence, and diarrhea. We've fully had topics on this. So some of the side effects that can happen with metformin, isn't it? But there is a lot. There is quite a lot. But a lot of GI side effects can occur with metformin. Yeah, it does, hence why I think they say with metformin you have to take it. So the maximum dose should be 3 times a day. So that means sort of with meal times, isn't it? Because it can cause that GI irritation. So that is the main side effect. But there is such a range of side effects, from, of course, 1 in 2 to 1 in a million. But we will definitely talk about that as a topic. We'll probably talk about diabetes as a topic. So we're just taking note of where we're going to add Nana. We're like, yep, add Nana. Perfect.
The next one was, would you recommend taking the pill when you have PCOS as first option? This is a topic that I'm also looking forward to, because PCOS is such a common thing happening to a lot of women, girls, and it needs to be spoken about. My answer to this is, first you need to speak to a clinician, because there are different medications that you can take it. The pill may not be your first option for you. It could be something else. So I would say I wouldn't recommend it, but because I don't know your situation, so I would say speak to your doctor first.
Yes, definitely. And we're almost at the end. So the next question, does taking HRT on and off have an effect on its effectiveness? And is that something that we would recommend?
Yes, I think it will definitely have it.
It would.
Effectiveness.
It's medication.
It's medication. And if you're not adhering to it, then of course you're not going to get the full benefit.
That's it.
I would say definitely.
Yeah.
And if it's something that you should take it for a short term to help with your symptoms, then why not?
Yeah, but HRT, I think, as a topic is something because HRT is so broad, isn't it? Yeah. And also just talking about if you need it, if you don't need it, is that what other alternatives there is? Because there is always going to be alternatives, isn't there? So yeah, definitely a topic.
And I think the last one I have on here, which, get ready for, it says, can you get pregnant whilst you're pregnant? Should you be wearing condom then?
Can you get pregnant whilst you're
already pregnant?
Yeah, a second pregnancy.
Mm-hmm.
Yeah.
I don't know, but TikTok will say yes.
What's it called? Series. Where this.
Wait. Is this like a real, a documentary? Because you know what I mean? Some of these things are.
Together. So I saw this series where this lady did actually get pregnant while she was pregnant. So it was a double pregnancy.
Right.
And then I also came across someone on Instagram who was saying, okay, she gave birth.
And then later on.
6 months later, she gave birth to another child. It's actually
I've seen it.
But it's rare. It's called superfetation.
Yes.
So that's how I came across it. That's what a TikTok would say yes.
So, yeah.
Because if it wasn't.
But now it's more of when there need to be studies done. Do you know what I mean? Yes. No, you're right. TikTok will say yes. It is.
It's rare.
In animals, though, it's not very rare.
Yes.
In animals, in humans, in animals,
Yeah.
and I think we're not very different from animals. We're not very different. So if that's why I think maybe this is something that people are even talking about, because it's something they've seen in animals as well. So when it happens to you, you're like, wait, hold on. What happened there? Yeah.
That's so interesting, because then they say you should be ovulating before you get pregnant.
That's it.
So when you're pregnant, ovulation is not happening.
Yeah.
So this is very interesting.
Yeah.
That's why they said it's so rare. So rare. Because in most cases, when you're pregnant, as you said, ovulation shouldn't be taking place.
No.
Exactly.
So
no, that's
you shouldn't be getting.
It is interesting.
I guess if it does happen, you're one of those rare.
Yes. If it happens, please get in touch with us.
Yeah, we would love
get in touch. We want to know the story.
I saw this girl on Instagram. I'm telling you, she was like, she's got a 1-year-old baby and a 6-month-old baby.
Wow.
What?
Oh my goodness.
Well, we need to find her.
Across 9 months, but 6
Yes.
months.
6 months is
literally that close.
Yeah.
Wow.
That is, I mean, I'm sure there should be an explanation for it, maybe a delayed fertilization or something like that. So, it is quite a topic that will shake season 2 a little bit. So, that is, yes, come and explain. Yes, 100%, honestly, 100%. But this is this is exciting. I'm really excited for season 2. It's going to be exciting. So Nana, if you don't mind, we will be getting in touch about you joining us for season 2. A few of the episodes, because I think some of them we will have answers to as pharmacists, and we can talk about it in depth. So that will be really, really good. And I hope you have enjoyed season 1. It has been great. It has, good. Oh, if Nana hasn't enjoyed it, come on, guys, you must have enjoyed it as well. We are really looking forward to season 2. We will definitely keep a lookout on our socials, so across sort of like Instagram, YouTube, TikTok. We will be putting when we will be back on with season 2. It shouldn't be too long, but we all need a break. As we said, pharmacists, we do go through a lot of stress, so we do need a little break. But thank you so much, Nana, for joining us today. Thank you for giving us the perfect end to season 1. I hope that we'll see you again season 2.
Oh yes, definitely. Thank you for having me, ladies. I've really enjoyed myself.
That's good.
When you're a group of friends, you just chat. Yeah. Didn't feel like I'm being, but I love it. I love it.
Oh, that's good.
I've enjoyed this, recording. So thank you.
That's perfect.
I'm always available if you need me.
Yes. No, we will be in touch. That's why this is the Consultation Room Podcast. Yeah, we want to be as honest. We want to have a laugh with, as girls. We don't want you to feel like you're going to the doctor and you can't really talk about some things. This is like, it needs to be a platform where literally anything and everything goes. Yeah. So this is exciting. Yeah. Perfect. Okay. So, look out for season 2. We will have a lot to talk about in season 2. And, in the meantime, if you have any questions, if there's any topics that you want to be included in season 2, please get in touch. Our Instagram, our email, our YouTube, our TikTok, however way you want to get in touch with us. We'll still be replying to any messages that we get until then. But until then, see you all soon.